this is the video competency for patient skin prep for MA 180. The first step on your competency sheet says to go to the other room and do a medical aseptic hand wash, which you will need to do for this competency. The second step is to gather your equipment. You're going to gather items for your side table, which will include your betadine, your sterile water, a discard bowl, and sterile gloves. Then you're going to gather your items for your sterile field that you're going to set up. All these items should be wrapped in a sterile manner, and that includes 3 surgical bowls, a sponge forceps, 4x4 gauze, a fenestrated drape, and a sterile drape. Once you have all of your items gathered together, including 2 trays, you'll need one for your patient. This with an absorbent towel on there. That's what your patient's arm is going to go on. And the other tray is going to be for your surgical field, your sterile field. Now, when selecting your trays, be careful. This particular tray does not adjust. So this would not be a good tray for your patient's arm. Okay? Because your patient wants to be comfortable. This tray does adjust. So this would be a good tray for my patient's arm. There's one Mayo stand that's really hard to maneuver because we are going to move these stands around. You don't want to pick that tray for your sterile field though because it's hard to maneuver. Does that make sense? So be careful in choosing your tray. All right? I'm going to set my patient tray aside for now, and I'm going to get my sterile field ready for the appointment. We don't set it up too far in advance. We want to wait until the patient shows up, and then we want to set up the sterile field before the physician is ready. All right, so the first item that you set up on your sterile field, it can be any item that you want. You can open any of these items in any order. The only thing is you have to make sure that you open your sterile drape last, because that's what you're going to cover your field with. Okay, so that's the only thing that has to be last. I recommend that you do a bowl first because the bowls can be kind of tricky to drop onto your sterile field. So I always start with one of my surgical or sterile bowls. And this first item is the only item that's going to be opened on the tray. The rest are going to be opened in the air and dropped on the sterile field. Okay, so this first item will be opened on the tray, and our opening technique is always away from us first. And then we're going to do one side, and then the other side, and then towards us last. So now I need to keep my eyes on my sterile field, not turn my back on it, and open the other items in a sterile fashion. Okay, so again, the first item is opened on the tray. The rest of the items are going to be opened in the air and dropped onto the tray. So I need to be above my waist, not at my waist or any lower, above the waist, and I'm going to open away. Be careful not to open over your sterile field. See how we're in that airspace over the sterile field, and you don't want to do that. Okay, you don't want to be too far away, and you have to see your sterile field, but open away, then one side, the other side, and then grab onto that bowl while it's still sterile. Pull back this drape, because once those drapes have been open, anything that falls down to the side is considered non-sterile. Okay, and then drop it onto your sterile field. You don't want to set it because you don't want to risk contamination, because if any of this touches your sterile field, then it's contaminated. All right? And then just toss that drape aside. And then move on to your next item. So I'm going to open my bowl next, my other bowl, my third bowl. Again, away, side, side. I'm going to grab this. And you want to try and utilize the center of your sterile field as much as possible, because you want to stay away from the edges, because we have that 1-inch border that is kind of our gray area between sterile and non-sterile. So again, now I'm going to open up my 4x4 gauze, and for this I'm going to try and drop it in a bowl. You don't have to just drop it somewhere on your sterile field, but if you drop it in a bowl, then again, you're kind of staying away from the edges. Now this is my sponge forceps. Same, nice above the waist, each side, then towards me last, and I'm going to grab onto it so I have control and try and utilize the center of my sterile field. Last item I have here is my fenestrated drape. So I'm going to unwrap it, and it too, I'm going to drop over there. So now I have all my items on my sterile field. And then the last item I told you to unwrap was your sterile drape, because now I need to go get my patient, and I can't leave my examination room with my sterile field left unattended. So I'm going to take a sterile drape and cover my sterile field before I leave. Now, one thing I want to show you, and I'm glad this happened. See how here this is not totally covering my sterile field? Does everybody see that, how that corner is kind of sticking out? It's not totally covered by the cloth. Should I do this, pull this over to cover it?
No.
Why not?
You just contaminated everything.
Exactly, because I can't say once this is over the edge it's contaminated and then magically, oh, now it's sterile, okay? So we would just leave it like that, and that's okay. My 1-inch border would just run like this then. Does that make sense? Okay, so that's what I'm gonna look for my border. So that's totally fine. Not ideal, but okay. All right, so back to my sterile drape. What I wanna do is I wanna grab this edge, okay, this corner, and as this unfolds, I need to make sure that the bottom of this, because this is going to be long, doesn't go below my waist or even at my waist. So as I pick that up, I'm going to grab it and I'm going to pull it real high like this. So you want to make sure your sterile drape is a big drape, big enough to cover your field. All right, so now what I can do is I can maneuver it to where I have a corner, and I'm going to cover my sterile field. And the manner that I cover it is I'm going to keep that drape between me and the sterile field so it's not contaminated. When I uncover it, I'm going to do it the same way. I'm going to start here, not here, because see how if I lift from this side, I'm lifting over my sterile field? So I want to lift from here and uncover, but I'm not ready to uncover just yet. All right? So that's how we're going to set up our tray. Now I'm going to set it to the side. I can touch it like this. I can touch it like this. Okay, because the sterility is contained inside and kept intact that way. Okay, because my hands aren't sterile yet. Now I'm going to call my patient. So I'm going to go out. Katie Bierman. Hi, Katie. How are you? And have you have a seat up here on the table if you would. Thank you. Katie, can you give me your birthday, please?
10/25/90.
Okay, fantastic. That's what I have too. The doctor said we're going to go ahead and remove that mold today. Okay. So the next step is to identify your patient, and we're going to do that by confirming their birthday. And then also seeing if they have any questions. All right, Katie, do you have any questions about the procedure today?
I do not.
Okay, you want to go ahead and lay your arm up there. Nice and comfortable, because we're going to be like this for a little while. Have them on an absorbent pad underneath there. Is that high enough for you, or do you want it higher?
No, that's fine.
Okay, so you need to make sure that you adjust the tray prior to going to set up your field. Because if you don't place your patient's arm and adjust the tray, then you have sterile gloves on, I can't do any of this, because I'm contaminating them. Okay? All right, Katie, you're good and comfortable? All right, great. I'm going to go ahead and set up your field, okay? Just relax. So now I'm going to come back over here to my sterile field. Once I uncover this, I need to make sure that I keep it in my eyesight, okay? Because remember, we can't turn our back on our sterile field, and we talked about how to uncover this field, all right? So once you have your patient set up, the next thing you're going to do is to uncover your sterile field, and then you're going to pour your liquids, all right? The way to pour your liquids is that's why we have this extra discard bowl over here. When you pour a sterile liquid, what you want to do is when you take the cap off, you want to set it down with the cap up. If you set the cap down like this, it contaminates the inside. So, cap up. You always want to make sure that you have the label pointing up so that if you dribble, it doesn't dribble across the label. Okay? So I can see the label's at my palm, so it's up, and I'm going to pour just a little bit off the side, because what that does, see how that cleanses the side of the bottle? So I want to cleanse it, and then I'm going to come over here and pour some on my sterile field. Notice how I'm not going to go right over the middle. I'm trying to minimize my reach over the sterile field, and I'm just going to pour on the sterile field what I need. Okay? Then I'm going to do the same thing with the sterile water. Take my sterile water, remove the cap, set it down properly, label up, a little cleanse, and then a little pour over on my sterile field. And we have to be careful so it doesn't splash, because remember, any moisture compromises sterility, so if we splash that on our sterile field, we may have a problem. So do you notice how I'm walking back and forth like this so that I can keep my eyes on my sterile field at all times? I'm not turning my back. Okay? All right. So the next thing I want to do is I have everything over there poured, and you have to pour your liquids and position your patient before you sterile glove. You can't sterile glove and then pick up this bottle, because this bottle is not sterile on the outside. All right, so now I'm going to do my sterile gloving. And y'all know you have to do your sterile gloving right? Okay, so I'm going to open my package. I want to make sure that stays open. The only hand wash you're allowed to simulate is your surgical aseptic. And then you're gonna put your gloves on. And again, I'm standing so that I can see my sterile field, okay, still in my eyesight. Not turning my back on it. Now I can turn my back on that sterile field because I'm done with it. Okay. Didn't see the rip. Okay, so you put your sterile gloves on. I should have got new gloves instead of old ones. All right, so now what I can do is I can touch my sterile field and I can set up my tray the way I want it. All right, so I'm gonna move things around, the items that I dropped in the center. And I wanna keep this in front of me because I'm gonna work on the patient's arm, and I don't wanna turn my back on the sterile field. A common mistake that happens here is students leave this here and then they get their stuff ready and they do this, and then can you see your sterile field if it's here? No, you kind of have to keep yourself open. So you can move this tray around. Can I touch this tray like this? Nope, not over the edges. If I can touch up here, but I can't touch down, okay? So you gotta remember to leave your hands up throughout this procedure. Even if this hand isn't doing anything, you can't let it drop. It's gotta stay up. All right, so the first thing that I wanna do is I'm gonna take 2 of these 4x4 sponges and I'm gonna fold it in fourths, okay? So here's the frayed edges. And what I want to do is put it in my sponge forceps so that the frayed edges are towards the sponge and that the folded edges are outward. That gives me more control when I'm scrubbing on my patient's skin. Okay? So then I'm going to dip it in a little bit of betadine. Make sure I don't drip on my sterile field. Then I'm going to come over here. Again, see how I can see my sterile field? I'm not turning. All right? All right, Katie, this is going to be a little cold. You're not allergic to iodine, correct? Okay, great. We're going to go ahead and clean that area. And what we're going to do is clean the area back and forth and up and down for 2 to 5 minutes. Okay, so we're going to do a good scrub because remember, we can't sterilize the skin, but we can disinfect it really, really well. All right, so on the checkoff, if you say, okay, I'm going to scrub back and forth and up and down, and you show me and say that, then I'll say, okay, your time is good. Okay, but in real life, you need to scrub for that amount of time. So then I'm going to take this and put it in my discard bowl. Next, I need to rinse the patient's skin. So I'm going to pick up my sterile water. Okay, this is going to be really cold, just a warning. And I'm going to pour it over the area. Now what I'm going to do is I'm going to take a couple of these sponges and I'm going to pat it dry. Again, at all times, keeping kind of an eye over on my sterile field. You have to be careful when you do this pat dry that you don't get your gloves wet. Okay, so you have to be real careful. Put that in my discard bowl. Then I'm going to take my 2 more 4x4 sponges, fold them in fourths again. Again, this time I want to make sure I have it in my sponge holder the same way. And I want just a little bit of betadine because this time I'm going to start in the center and work outward. So it's real important that you don't go back over any of the spots. If you miss a little piece, that's okay. You just need to keep going outward and not go back over the same place. So I'm going to start in the center, and I'm going to scrub outward. It doesn't have to be real far, just an inch beyond the edge of whatever we're removing. Okay? I'm going to put that in my discard bowl as well. Then I'm going to pick up my fenestrated drape. Again, making sure it does not fall below my waist. And I'm going to cover the patient with just the area exposed, not reaching over that fenestrated drape. Now the patient is ready for the doctor to come in and do the procedure. I can move this out of the way, and this is where your checkoff will end. Okay, once you drape your patient with that fenestrated drape, that's where we're going to stop. Okay? So a lot of steps to remember, a lot of sterile principles to remember, but once you've gone through and done it a couple of times, it's a lot easier than it looks. Okay? All right, you can stop.